Hopefully you've been reading about him in High Country Health and Fitness, our latest edition of our magazine. Tim Baxter, along with Jeannie Bradshaw, who is Director of Rehabilitation Services for Appalachian Regional Healthcare System. How are you?
I'm trying to stay warm.
Yeah, it's winter, isn't it?
It's winter. It's arrived.
Yeah, for sure. Hey, we're at the Boone location, and if you haven't been reading, we hope you'll take a moment to pick up a copy of our magazine and read about the rehabilitation services that are offered by the folks here in Boone and also in Linville, at your Linville location as well. You guys are doing some amazing things these days.
We are. We're really fortunate to have really integrated clinics into the wellness setting, both here in Boone and in Linville. And we also are doing wonderful things in inpatient care, home health, skilled nursing, all those types of facilities as well.
The location where we are today is the Boone location, which is right next door to the Wellness Center, actually kind of attached to the Wellness Center. In Linville, you're located right there at the hospital, right?
Right, and it's actually attached to the YMCA, so it's in the Sloop Medical Plaza, really just adjacent, attached to the Y.
You know, you were telling me before we started that the whole idea is to be the total rehab resource for somebody that needs it, whether it's inpatient or getting them to outpatient services, getting them back to where they don't need your services at all.
Right. That's the great thing about the healthcare system, is that we have rehab services that cross the continuum of care, you know, starting at inpatient, going to home health, going to outpatient, going to skilled nursing. We're really able to follow the patient through the entire continuum. And we have staff that actually can work and float in the different areas, so it's great for patients. They know familiar faces, and, you know, we follow them all the way through.
Yeah. Luann joins us now. We're going to talk about this facility in particular, because there's some special things you do here that folks can't get anywhere else around here.
Absolutely. We are very fortunate that we have therapists. Our total years of experience are about 22, so we've all been around for a number of years. We do have a new therapist on board, which has been a wonderful addition to our neuro team, but yes, we have all been around for a number of years. We also have specializations here. We have a neurotherapist who work with our neurological disorders. We have therapists that specialize in orthopedic disorders, chronic pain, occupational therapy, speech therapy. So we can be generalist, but the advantage that we have is that we can specialize, and we do specialize.
And how important is that these days?
It's critically important. Just with everything else, technology has boosted our profession so that it's very difficult to get a grasp of being a generalist anymore, because you have to know so much for every specific disease entity and condition. So it really behooves our profession to specialize, and in fact, we have specialization certifications now within our profession, just like the medical profession does. Wow. Yeah. So we are very fortunate that we have therapists that do have those niche practice areas.
Neurocom, what is that?
The Neurocom is this machine behind us, and we are very proud of that. There are not that many in the state of North Carolina. And what this does is it gives us the ability to analyze postural deficits, balance deficits, whether it's with the neurological population or the orthopedic population. It is an assessment tool, as well as it allows us to then treat the patient using this piece of equipment. So we have a force platform, and then we have this box behind us that allows us to change the environment so that folks with balance disorders can accommodate, and their vestibular system can relearn how to integrate the vestibular and the visual system and the proprioceptive system so that they can then return to normal functioning.
Yeah, you have a therapy pool here too.
We do have a therapy pool we're very proud of. We keep the water at 89 degrees, so those folks that otherwise would not go into a lap pool, which is kept much cooler, can get into this pool, move a little slower, but still be very comfortable. And it's a shallow pool, so we don't have to worry about deep water. And it allows them to be weight-bearing, but not totally weight-bearing if that's not called for at that particular time of the rehab.